Guys, look at this. What are the complications of pulmonary tuberculosis? They've asked for 5 marks. Okay, so the tuberculous bacteria has affected what? The lungs. Okay, now see, the tuberculosis bacteria, Mycobacterium tuberculosis, it can affect a lot of things. It can affect your spine, it can affect your brain, anything. But here they're saying it has affected what? The lungs. Okay, so this is pulmonary tuberculosis. Because of this, okay, what can happen? Okay, what are the complications of pulmonary tuberculosis? They've asked for 5 marks. So you must understand here, don't land up writing pot, spine, meningitis and all that. Okay, they are asking pulmonary tuberculosis complications. According to the textbook, these are the complications which you will write in the exam. Okay, first we will write one small introduction. It is tuberculosis is caused by Mycobacterium tuberculosis, is a bacteria. Acid fast bacilli, please mention this. What will you say? AFB, acid fast bacilli. Okay, it is AFB. And then how will you draw it? In Ziehl-Neelsen stain, they are showing like this. Okay, something like this with, it will have some dots also we show on it actually. Okay, so you will show in Ziehl-Neelsen stain. If you can draw it, you can draw it, but that is not what they have asked you. The complications of pulmonary tuberculosis. Okay, just an introduction we have given. Okay, now what are the complications of pulmonary tuberculosis? Pulmonary complications first we will talk about. Then we will talk about the non-pulmonary complications. Okay, guys. So there are only 2 slides here. So let us get started. Okay. Then lastly, we will just add one small line: prevention and treatment. Okay, that is what is the slide that I have prepared. Now let's get started with the actual content. Okay, which is the pulmonary complications of pulmonary tuberculosis. Okay. So the lungs are affected, right? The lungs have what? The bacteria. So what can happen? Okay, so because of that there can be bronchiectasis. Bronchiectasis means what? You can see that in the airway there is a lot of mucus. Okay, so this person will be coughing a lot. Okay, so this is bronchiectasis. You will write this in the exam. The first thing that they are saying is what? Bronchiectasis. You'll be able to write this, right? Just think lung, everything around it. This guy will have massive hemoptysis. He will vomit, or sorry, the sputum will have blood, right? Not hematemesis. Hematemesis is blood vomit, but hemoptysis is blood in the sputum. You got it, right? You will write this: massive hemoptysis. Cor pulmonale. Now what is cor pulmonale? Okay, so everything, just imagine now the lungs are all affected. So what will happen? The heart is not able to pump to the lungs. Who will pump to the lungs? So if this is your heart, okay, and here are your lungs, I am putting the lungs here. Who will send the blood to the lungs? The deoxygenated blood, the right ventricle, right? The right ventricle is supposed to send the deoxygenated blood into your lungs so that it can oxygenate it and send it back to your left atrium, right? So here, because the lungs are totally affected, the heart, the right ventricle of the heart, this one, it becomes hypertrophied. Okay, it is not able to push to the lungs. Okay, you got it. So cor pulmonale, this is cor pulmonale. It is a complication of what? Pulmonary tuberculosis. Where is the pulmonary tuberculosis? Here. Okay, because of which the heart cannot pump. So there is hypertrophy of the right ventricle. So this is cor pulmonale. What is it? Cor pulmonale. Are you there with us? Good. Take a deep breath. We have finished 3. What did we see? Bronchiectasis, massive hemoptysis, cor pulmonale. Okay. The diagram we have put here is of the cor pulmonale, guys. So look at this. The right ventricle has hypertrophied here. You can see that. Yes, very good. Okay. So now let us look at, let's continue. Okay, let's continue. Here we are, fibrosis, emphysema. See, either fibrosis will happen or emphysema might happen. What is fibrosis? Everything getting kind of calcified to fibrosed, right? Or emphysema is where the alveoli septa gets broken. So in the lungs, in the last part of your airway, what do you have? You have the alveoli. The alveoli will have some septa and all. All those septa get broken, right? So what happens if the septa gets broken? The alveoli will be full of air and the air cannot get trapped, come out. It will get trapped inside. That is emphysema, like a smoker, how it will be. Okay, so it can become like that. Okay, then we are proceeding, guys. Are you okay? Are you happy? Very good. Think about what can happen. Now here in the lungs there is Mycobacterium, right? Tuberculosis bacteria is sitting. They are saying other infections can happen like atypical mycobacterial infection. This information has been taken from Davidson textbook, so you can trust it. Okay, atypical mycobacterial infection, other bacterial infection, basically they are saying added to this existing infection. Then fungus will come and attack. Aspergilloma can happen, chronic pulmonary aspergillosis. Okay, so that is again fungal problem. Okay, then obstructive airway disease. Obviously all this is happening, then the airway will get obstructed. Correct, people? You will write all this right in the exam. Everything pulmonary complications we are talking about. Okay, in and around. This core pulmonale is more like a cardiac, but yeah, okay, because of the lungs around it. Bronchopleural fistula. Bronchopleural fistula. So from there is a opening between the bronchus and the pleura. Wow. So I'm thinking there can be a lot of leakage or something. Okay. Then just remember this. This is bronchopleural fistula. Bronchopleural fistula. Bronchopleural fistula. Bronchopleural fistula. Okay. Then lung pleural calcification, pleural thickening. Okay, something like that only, thickening, fibrosis kind of a thing we said, right? So in this they're talking similarly only, calcification, thickening of the lung or pleura. Here we said fibrosis directly we said of. Okay, so some kind of calcification, thickening, all that you will write. Now can you summarize, guys? Can you summarize, because of pulmonary tuberculosis, what are the pulmonary complications you will have to write? Okay, bronchiectasis, massive hemoptysis, core pulmonale, fibrosis, calcification, thickening, emphysema, other infection as fungal infection, obstructive airway disease, bronchopleural fistula. Okay, this much you will write. Okay, now let us move on to non-pulmonary complications, but definitely you need to take a deep breath. Very good. Non-pulmonary complications also, they are putting pulmonary complication only. See, empyema necessitans, pus-filled infection of pleural space. It seems again, I'm thinking it's around the lung only. Laryngitis, okay, now they came a little up. Laryngitis, okay. So here, laryngitis. Where is your larynx, guys? Your voice box somewhere here. They're talking about laryngitis, okay. Then enteritis. So what will happen? You swallowed all the sputum. So in the stomach, in your stomach, draw a stomach. This is going to be a crazy stomach. Okay, the stomach enteritis, they're saying, okay, because you swallowed the sputum, which has all this mycobacterium, tuberculosis, anorectal disease. So here then you're going here and finally here rectum something here. Anorectal disease, they are saying. Okay, are you there with us, guys? Anorectal disease. Enteritis, because of swallowed sputum. Enteritis, anorectal disease. Then amyloidosis, this is some protein deposit, right? And then Ponset's polyarthritis. Ponset's polyarthritis means it's tuberculosis. You can, if the diagnosis is written like that, because Ponset's polyarthritis, what is happening? It's an immune response to active tuberculosis. There'll be no infection of the joints. Okay, this is an immune response to active tuberculosis. Ponset's polyarthritis can happen. Did you see here that we are not mentioning things like meningitis, pot, spine, etc.? I hope you have understood that. Okay, peritonitis, nothing like that we have mentioned. These are specifically mentioned by the textbook as complications of pulmonary tuberculosis. And in non-pulmonary complications, they talked about empyema necessitans, laryngitis, guys. Touch your larynx, then touch your stomach, enteritis, anorectal disease, then amyloidosis. I think we will end up forgetting amyloidosis in the exam. So just remember, okay, amyloidosis, this abnormal protein deposit, and then Ponset's polyarthritis, Ponset. You have to remember this word, Ponset's polyarthritis, okay. So these are the non-pulmonary complications. Sorry, non-pulmonary complications of pulmonary tuberculosis according to Davidson textbook. Okay. According to me, I think in pulmonary complications, we will end up forgetting hemoptysis, and in non-pulmonary, I'll end up forgetting amyloidosis. Guys, this is not there in Davidson textbook as a complication of pulmonary tuberculosis, but we will add it because we don't know what they are referring, right? So we will say that it can cause pleural tuberculosis, right? Pericardial disease, lymphadenitis, then come to stomach, say gastrointestinal tuberculosis, central nervous system, meningeal disease, TB, meningitis, etc. Genitourinary renal tuberculosis, you have to mention, and POTS disease, pot spine, okay? Please write all these also, okay? And if you have time, then add this also. If the person is taking treatment, there can be complications because of that, like hepatitis, drug resistance can happen, failure of oral contraception, etc., right? That is because of rifampicin. And you can write standard things like rash, etc. for any drug, right? So all this you write. So guys, to summarize complications of pulmonary tuberculosis, what the textbook says and what the we have found, everything we will write, okay?